When people are sick or injured, having health services readily available becomes very important. Health careers provide such services and cover a wide variety of jobs, from highly specialized professional workers to less specialized auxiliary workers. Hospitals employ about half of all workers in the health field. Others work in clinics, public health agencies, nursing homes, and laboratories.
Okay. Good. Okay. Well, you have some noises in this side.
Physicians or doctors are well known to almost everyone for the work they do in medical examinations, in diagnosis, and in treating injury or sickness.
When a person comes in that is ill, we have several parts of an examination that we do. The first part is talking and trying to listen to the person tell about what is bothering him. This gives us the most information. The second part is examining the patient and trying to find with our fingers and our ears and our eyes what we can objectively find out about this person, what makes him different from a normal person or a healthy person. The third part is doing lab work and x-rays and various tests that can give us some hints as to what's going on. And from these different factors we form a diagnosis. Hi.
Hi.
How you doing?
Fine.
Any problems?
Still taking those pills.
For the nausea?
Mm-hmm.
They still helping?
Mm-hmm.
So, let's see, how far along are you in your pregnancy?
Today, most physicians specialize in a particular field of medicine, although large numbers still provide general practice or general patient care.
It's a hard thing to say, particularly what I enjoy about being a doctor. I think it's enjoyable helping people to feel better, and the feeling of accomplishment when you do that. The money is fairly good. There are a lot of things that we can point to that are bad things. You know, the long hours and the long years of training getting here, and the odd hours getting up at night and phone calls and this sort of thing. But overall, it's a feeling, I guess, most of all, that you feel like you're doing something important and helping people that aren't feeling too well.
Apart from many years of formal study, the physician must be prepared to spend many hours keeping up with the latest advances in medical science. All health organizations require effective management to function properly, and health administrators, under the general supervision of a board of directors, provide this management. Administrators coordinate the various functions and activities that make a health organization work. They may do this personally, where the organization is small, or direct a staff of assistant administrators in larger organizations.
Don, I was thinking, you've been training coordinator with the health aid program now for almost a year, is it?
About 11 months.
Yeah. And I think you've done real well in coming back to Alaska and assuming the job and some of the responsibilities that we have. And I was kind of thinking maybe you're ready to take on a little more responsibility on the job, and was wondering if you feel ready yourself. Well, what we try to do is to get the employee to take on more responsibility in his job and delegate that responsibility to him so we can see how he handles it and what its follows through is. And to me, that's the the best way of getting realistic on-the-job training going. Well, I think the thing that really turns me on is to see people get involved, to acquire new skills, and to advance in these skills and responsibilities. One of the beauties of the health aid program is that we do see results. We do know that 200 or 1,000 people are seen annually in Alaska by the 215 community health aides that are now provided.
Jim, do you think we could consider it an option or a possibility that we utilize the existing health aid persons for administering this program?
Sure, I think that's one option. In fairness to the health aides, though, I think we have to look at the impact that has on them. You know, that many of them are saying, gee, I can't do one more responsibility, and for us in Anchorage to ask them to do things that are difficult to do.
The administrator makes management decisions on such things as planning and budgeting, personnel and equipment, and in many cases promotes public participation and handles public affairs. Laboratory tests play an important part in the detection, diagnosis, and treatment of many diseases. And medical technologists are the laboratory workers who perform these tests.
I consider the job as a medical technologist as the main stepping stone or link between the doctor and the patient. And for the doctor to diagnose and detect and treat a patient, he really needs the laboratory tests to really do his job thoroughly. Okay, open your fist. Oh, that's good.
Is this going to tell you my blood type?
No, not this test. It will not. Okay, now put pressure and hold your arm up. That's good. After drawing the blood, which is the first step in the patient's care through the laboratory, I bring it into the hematology department and log the specimen in so that there won't be any mix-up between any of the patients in the hospital, since there are so many. Then I put the specimen on the rocker to mix it up well, and then I put the blood through the coulter, which takes a complete blood count, which is the complete white blood cell count, the red blood cell count, the hemoglobin and the hematocrit, and some indices also, such as the MCV and the MCHC. Then I do the differential by using the microscope, and the purpose of the differential is to differentiate the different cells, such as the white blood cells, in which we can have polysegmented neutrophils, we can have eosinophils, neutrophils, basophils, we can have monocytes, we can have lymphocytes, and depending on whether they're abnormal or abnormal, can tell the state of the patient.
The technologists work with physicians, scientists, and other laboratory workers and receive thorough formal training and specialized short courses conducted by hospitals and vocational colleges while on the job.
Several different departments in the field. You have urinalysis, you have blood banking, you have chemistry, microbiology, and hematology. And when I first started, which was only about a year ago, I enjoyed chemistry a lot because you do a lot of manual procedures, and I like to really see what's going on when you add one chemical reagent to another. Whereas, hematology involves, you use the coulter, where you just feed the blood to the machine and then you get the results, and you really don't see what's going on in the machine.
Nursing plays a major role in health care, and as members of the health care team, registered nurses perform a wide variety of functions.
Go ahead, sit up. Good. How are you feeling this afternoon?
Fine.
This is Phyllis, and she's our new LP, and I'm going to teach her how to change this dressing, and she'll be taking care of you tomorrow, okay?
Okay.
When I came back to Alaska to work here in Anchorage, Alaska Native Hospital, I really enjoyed it. You know, I just felt like I was really doing something for these people, because they appreciate so much, you know, what you do for them. You know, like they come from the villages and they're lonesome, they're lonely, and some of them can't speak English, and you know, they're lost. And when they find out that you're an Alaska Native, they open up to you, and it seems like, you know, you really get a challenge out of taking care of them. They appreciate everything you do for them. Okay, I'll take these off. How old is your little sister?
4.
4? I didn't even know you had a sister that young. Just kind of wash the area off. You tell me if I make that too tight, Marie.
One person you can't find very good things on.
Yeah, that's the reason why the doctor had to do the cut down, so he could get the IV going.
Registered nurses observe, evaluate, and record symptoms, reactions, and progress of patients, administer medications, assist in rehabilitation of patients, instruct patients in proper health maintenance care, and help maintain a physical and emotional environment that promotes recovery. Working in many towns and villages, community health aides specialize in the delivery of primary health care services. They work mostly in the village clinic, providing first aid in emergencies, examining the ill, and performing routine lab tests. In addition, the health aide reports patient symptoms to the physician and carries out the treatment recommended by the physician.
You're at 99.2, you have a low fever. Is it sore under here?
Yeah.
I'm calling about a 10-year-old girl who I went to see this morning. Her babysitter said that she was awake with a bad cough and a fever and complaining of a sore throat. The patient advised that she has many allergies. Her mother is not here. She had taken a trip to Anchorage. So I examined her throat and tonsils are red, no sputum. We're on call anytime for emergencies. We see all kinds of patients. People with colds, ailments of all kinds. It could be, you know, from an old injury, sometimes arthritis sets in and, you know, it could be that. We'll just watch it and see how it is, you know, how it turns out. There'll be a doctor coming here maybe in September.
Hurt. Not all the time. You know, my heart, it don't go, you know, fast or anything, but every once in a while, I don't know how to,
Yeah.
it's just, you know,
Oh.
and then
Yeah.
after that, you know, I get weak, and from that, it feel hurt.
All around there, huh?
Yeah.
In your muscles. Like in the muscles of your chest here, huh?
Yeah.
Well,
I wonder.
I'll listen. I'm going to listen to your heart and then I'll take your blood test.
My good heart.
Counseling patients, giving health education talks, and coordinating community health needs round out a busy schedule.
Stings, doesn't it, huh? Okay, I'll just put in slowly so you won't get too sore, okay? Okay? Now, all over. That sting? You okay? All right, good boy.
Proper dental care is an important part of overall health care, and dental assistants help dentists while they are working with patients. This assistance includes preparing the patient for treatment, working with the dentist handing the proper instruments back and forth, and keeping the patient's mouth clear by using suction or other devices.
Well, basically, we get the patient in and we chart the dental chart for the doctor when he's doing the exam. And we take x-rays if they request it. And we take impressions of the mouth, if they need dentures or partials or crown. And we set up, for operatories or fillings, set up the instruments and for surgery and root canals. And we place rubber dams if the doctor wants us to, to keep the water away from if we do root canals. And sometimes we make appointments, when our receptionist's not here. We take it, after we take impressions of the mouth of the patient, we pour the model up. And after it sets up, we trim it, like what I was doing the other day. And there you go. Alrighty, are you ready?
So really be simple,
Real white.
really be quick, okay?
Real white. Yeah.
I'm just collecting on these stones that we placed. I'm assuming did it.
A nice shiny filling then. Look a lot
Our
better
idea is
too.
to smooth the edges off so it doesn't break down as fast. But you didn't know that, did you, Jackie?
You're doing good. Nice and shiny. Good.
That should be all.
You did good.
The education and other requirements for work in the health field are as diverse as the health occupations themselves. That is, opportunities for employment exist for people with widely different educational backgrounds. Health careers offer a very wide choice of jobs for people who are interested in the prevention and treatment of injury and sickness.